In this video, we are going to talk about the different types of bumps that can appear on the surface of our dog. I'm going to explain to you that there are basically 5 main types. I will explain how they look, how they are noticed, what you have to do to look for them, and above all, which I think is going to be the most important, we will talk about a protocol, about what you have to point at in each bump, what you have to look at to help your veterinarian to have a more accurate diagnosis and therefore a much more effective treatment. Look, 5 major types of bumps are basically distinguished in dogs. Sometimes in veterinary terms we call them bumps. First of all, we have tumors. And it's like that, it's not like that, I'm very sorry. Tumors are something that is very present and more. You have to know that from the age of 10, 1 in every 2 dogs will develop a tumor, and this tumor is initially noticed as a bump on the skin. Secondly, the second major type of bump are abscesses. The abscesses are basically linked to a bite, that is, there is a collection of purulent material under the skin that also gives us that look of a bump that gives us so much fear, but that you really have to look for and differentiate a tumor from an abscess, for example. Then we have the hematomas, the classic hematoma after a blow, that collection of blood that occurs under the skin that is also the cause of a bump to palpation. As a fourth type of bump, we have the healing keloids. These are basically scars that, for a certain number of reasons, are enveloped, form bumps, have a hard corneal look, and can also be confused with tumors. And the fifth major type of bump are the famous wrinkles. In this case, they are intranscendent, except for the fact that they can be in certain areas of the dog's skin where, due to their location, they can be especially annoying. But of course, as I said at the beginning, 1 of every 2 dogs from the 10th year of life, it is normal for it to develop a cancer. And you have to get used to licking the dog. You have to start licking him, if not every day, every 2 or 3 days. Licking the face, going back, licking the ears, going down to the neck, licking the whole back, and then going down to the legs, to the interdigital spaces. Wasting a little time noticing licking. This, if you are women, is more or less what is usually done from the age of 40 to 45 with the mums. You stand in front of the mirror, notice shapes, bumps, situations in which one can feel that there is something strange here that was not there a week ago. Well, in the case of the dog, it is exactly the same. And as soon as you notice these bumps, it is convenient to take him to the vet and have prepared a series of answers that your veterinarian will always ask you. And in this, it is important that we pay a little attention. First of all, it is the first time he has a bump. It has never come out before. It is the first time you feel it. This is a very important fact that you have to write down. Have you noticed any other bump, or is it just that bump that you have noticed? There, in another part of the body that you have noticed, that you have thought it could be, never stay in doubt. In the face of doubt, nothing, ask. You are the one who pays or the one who pays. And therefore you are entitled to say, look, I think he has a bump here too, please check it. Write down clearly, since when you notice the bump, how long has that swelling in your dog? Do you notice that it hurts the palpation? This is also an important fact. It is a painful point. At the touch, the dog complains, licks, bites that bump. Do you notice that the bump is hot? Hotter than the rest of the surface of the body, I mean. This is also a fact that to any veterinarian it will be of great help that you contribute. That bump may be related to a blow, some trauma, some injection that has been given to another veterinarian, some vaccine, etc. Also very important to take note. This bump is injured, that is, it is a bump that does not move, that is, as if it were caught to the structure that is below. This is a symptom, for example, of a malignant neoplasia. Or on the contrary, it is a bump that you move and it moves relatively easily. In whose case it already gives us to understand that while it can be a neoplasia, a tumor, it can be a more benign tumor. Let's say that bad tumors, the worst, stick to the structure they have below, either the muscle or the bone or whatever. On the other hand, the benign ones are more ductile, more movable. You notice that the palpation is very hard, or you notice that it is soft, that it could have something, or it resembles that it could have some liquid. This is also important. If you had some liquid, we would be talking more about a bump than a tumor. A bump that has occurred due to the obturation of some channel of evacuation of said bump. So hey, it's still good news. Anyway, and with all that, for your peace of mind, the most important thing is to take it as soon as possible. Because in a clinic, visually, Well, sometimes you can distinguish a canoide, obviously the race, because you know how to distinguish it, but it is not easy. And then you have to rely on a series of techniques. Basically, there are many. Do an ultrasound, do a radiography or whatever. The fastest thing is to puncture, take out liquid and send it to the laboratory. This in 24-48 hours, we know the nature of the cells that form that bump. And knowing the nature, if it is a cancerous nature, quickly, a bump, the cure, the mortality of a cancer, depends basically and plainly on the reaction time we take to bump it. Well, nothing more. Thank you very much. And see you in the next videos. Take care. Bye.